10 ways to avoid unwanted pregnancy. Having sex is one way to feel good with health benefits for those who are sexually active. People engage in sexual activity for two purposes: gratification and procreation. Here are 10 ways to prevent unwanted pregnancies. Abstinence. The act of refraining from sexual activity is known as abstinence. With a failure rate of 0%, it is the most efficient method of preventing pregnancy and STDs. However, the majority of people who intend to abstain from sexual activity do not. The barrier method. Use of condoms is involved here. We have both a male and a female condom. Condoms are widely used, affordable, and have the added benefit of preventing sexually transmitted illnesses like HIV and hepatitis. They are inserted right before having sex. A male condom can burst or slip off during sex, and it is also not suitable for males who are allergic to the latex. Male condoms have a 5% failure rate, but when used properly, they can help stop unwanted pregnancies. Female condoms are also used right before sex, and they have a 15% failure rate. The female condom can irritate your vagina and raise your risk of developing a UTI. The pill, combined oral contraceptive. The action of this estrogen and progesterone-containing pill is to stop the ovaries from releasing an egg. It must be taken at the same time each day in order to be effective. You can set a phone alarm to remind you of this. It successfully prevents unwanted pregnancies with a 1% failure rate when taken as directed. Women with heart conditions such as hypertension, migraines with aura, heavy smokers, and many others shouldn't use it. Before using this oral contraceptive, it's important to talk this over with your doctor. Combined hormone patches. It has a 1% failure rate and is extremely effective. This patch is applied transdermally and releases progesterone and estrogen to stop the ovaries from releasing eggs. 3 weeks of weekly application are followed by a week without a patch. Combined hormone vaginal rings. For 21 days, these rings are placed inside the vagina and then removed for 7 days. Excellent cycle control, especially for those who experience irregular periods. When used correctly, the failure rate is 1%. Mini pills or progesterone-only pills. This pill should be taken without missing a dose. When compared to combined oral contraceptives, it has fewer side effects. For nursing mothers, it is ideal. Also included are older women and women with heart problems. The failure rate is 3%. Injectable progestins. Depo-Provera and Noristerat are 2 examples of these. Noristerat lasts for 2 months, while Depo-Provera lasts for 3. Its negative side effects include the potential for weight gain, a protracted return to infertility, and persistent irregular flow. It has a 2% failure rate. Implants. Implanon is a good example of this. It is placed beneath the skin of your upper arm. Last for 3 good years. Ideal for long-term use. For those who dislike taking pills, this is a good long-term contraceptive method. It has the potential to cause irregular bleeding as a side effect. Intrauterine device. This is the application of a device such as a copper IUD or a Mirena. Although copper IUDs can last for 10 years, they can also result in heavy menstrual flow. Although Mirena can be used for up to 5 years and can lessen painful periods, it can also cause mood swings. Sterilization. This is the only method that will always work to stop pregnancies, and it works for both men and women. When the womb is removed through a procedure known as a hysterectomy, and the fallopian tube is tied shut through a procedure known as a tubal ligation, the failure rate for women is less than 0.13%. The failure rate here is 0.02% for men. Males can be sterilized through vasectomy, which is the cutting or tying of the vas deferens tube that transports sperm from the testes out of the body in order to stop sperm from entering the urethra. Thanks for watching. If you liked this video, make sure to subscribe for more.